Hi there, my name is Dimitri Hristev and I'm a Bulgarian physiotherapist who's very passionate about neurological rehabilitation. In today's video I want to talk about the crucial role of nursing care and the impact it has on my job. As a physiotherapist, my job is very simple. I need to make my patient move as soon as possible. So the active exercises are very important in the physiotherapy program for any neurological patient. Usually in the early stages of the neurological rehabilitation, the patients may not be able to perform any active exercises. Then I have to provide them with passive modalities like passive movements, for example. But when the patient can't perform any active exercises, this is what we do: activity and more activity. So it's very important the patient is in his or her best condition for every physiotherapy session. That's why it's very important for me to have a conversation with the people who take care of the patient, of my patients. Where I work with nurses or caregivers who are qualified and who have enough experience, it's easy. They understand their job and their role, and I can get the best results. But when I work with family members, I always spend some time with them talking about their crucial role in the rehabilitational team. So, which things are important in nursing care from my point of view? First, the first one is the patient needs to be well hydrated. And this is very important because when there is not enough liquids in the body, the blood pressure will drop. That means I cannot give enough active exercises to my patient. So the patient needs to drink plenty of water. The second thing which is important is the quality of sleep. The patient needs to be well rested. If he or she is not having good sleep, that's a problem for me. Pain management and giving the pills on time for managing pain is also very important. During the day, if the right medications are given on the right time, and also icing and or some painkillers in the form of gels are put it on the joint, that will make my job much more easier. What else is important? The urogenital infections are something very common in people with neurological conditions, so the hygiene has to be on good level, and the catheterization should be performed by qualified personnel only. Also, the orthoses are very important with people with neurological conditions, and when I work with the patient, I can put the orthoses correctly. I'm sure of that, but I have to be sure that the people who take care of the patient will also do this, because the orthosis needs to stay long periods during the day on the spastic extremity. So talking about the correct way of positioning the patient is also very important. A patient with neurological condition may spend a lot of time in the bed, but lying on the bed is very dangerous. So the family members have to understand that they need to turn the patient regularly, so the blood flow in the tissues of the back is good. Otherwise there will be a pressure source and when the pressure sore is there, it's very hard to heal, and we basically open a door for any opportunistic infections to go there and colonize and start making problems. These things are very important for me. That's why I usually, as I said earlier, I spend some time talking with the family members, and I think this is really important part of my job as a physiotherapist, because you cannot perform your job. I cannot perform my job fully and correctly if the patient is not in his or her best condition. So this is my second video in English. My video channel is most of my videos in my video channels are in Bulgarian language, but I will continue to upload videos in English. So I'll be happy if you give the video thumbs up if you like this information, and also if you share the video, of course. Also, it will be great if you subscribe for my video channel. I will be making more videos in English. Thank you and take care.